Namaskar viewers. Today once again we have a health quotient series, and today's topic is very vital. I would say some sentences and you will guess what I am going to talk today. Eyes are the windows to the soul. The is the jewel of the body. Can't help but get lost in those eyes. And तेरे आंखों के सिवा इस दुनिया में रखा क्या है, so and so and so and so, etc., etc. But as we say, everything that we can see is only through these eyes. And to bring that awareness, to understand the world around us, is very, very crucial part of our life. We should ask those who don't have this blessing, and how to maintain the health of this organ, as well as what kind of challenges or difficulties that we face as an infant, as a grown up person, or even towards the old age. So we should be aware of the development and so-called damages to the eyes. So to discuss this, we have a expert with us, and let me introduce to her. So we have Dr. Gunjan Deshpande with us. Dr. Gunjan Deshpande is, I would say, very warm person who accepted my request for this program and this educational video. So first of all, doctor, welcome to the program. Thank you so much for your time.
Good morning, and it is lovely to be here.
So doctor, first come first, very basic question. If you could explain us the arrangement of the eyes, the placement of the organs, and as a layman, how we understand this in a medical term.
Okay. I have a model over here. Is the model visible now?
Yes.
See, okay. Now this is the cut section of the eye that you can see. This is the front part, and this is the back part. Okay. Now, when we talk about vision, we talk about three things. The three systems which should be normal. This is the eye. The eye acts as a camera. It only will take photographs. It will only capture images and do nothing else. The images are captured over here. See, the light rays pass through the cornea, through the lens. They are focused over here on the retina. This is the optic nerve which carries all the signal back to the brain. The brain is the place where all the analysis should occur. All right. Now, in certain cases, I'm so sorry, I have to place it again and again. In certain cases, if the eye, I'm sorry, please cut this up. For normal vision, we have to have these three things normal. Your eye should be normal. The optic nerve, which will take the signal to the brain, should be normal, and your brain also has to be normal. If these three things are functioning well and properly, then your vision will be absolutely normal. If there is anything problematic with these three things, your vision will be reduced.
Now coming to the problem, because you are sitting here to solve our problems. So let's talk to you about the doubts and problems that we face.
I think now it is better.
Yeah.
Because this is how I explain to everybody, including my patients.
Okay. Dr. Gunjan, last week you said that we were not celebrating, but discussing glaucoma especially. We have heard this word very prominently and very often, and you specialize in this stream. So let's focus today's discussion on this topic alone. So first of all, what is mean by glaucoma?
Okay. Now we were talking about the eye.
Yes.
All right. Now, in certain conditions, the pressure inside the eye may increase. See, our eye is like a balloon. If the balloon has to be inflated, it has to have some water or some fluid or some air which will hold its shape. All right. Now, similarly, in the case of the eye, a normal fluid is present over here, which is called as aqueous humor. Now, this pressure should be around 10 to 20 millimeter of mercury. This is the normal physiological range. Due to any cases, if the pressure inside the eye increases, the optic nerve, which carries all the signal to the brain, this gets mechanically compressed. And that is why, even though the image over here, which may be formed, maybe 100%, very nice and very clear, the image, the signal which is sent to the brain is damaged. And that is why only the part which is being relayed to the brain can be visualized, and rest of the part which is being not relayed or which has been damaged will not be really and will not be visualized at all. This is basically glaucoma. All right, when this optic nerve becomes faulty because of raised pressure, there is one small subset in which the intraocular pressure may be normal as well, but still this optic nerve will not be able to tolerate even the normal pressure and subsequently shows damage. This is, in very simple terms, this is called as glaucoma.
Can it be only age-related issue, or it can happen at any stage?
Glaucoma can be congenital, can be juvenile, can be age related. You can have glaucoma in any age. But yes, normally what we see generally in our population is age related, generally seen after the age of 50 or 60. It is an age related condition. But yes, there are certain other conditions like congenital glaucomas which present since birth, or there can be juvenile glaucomas which are present by around 2 or 3 years of age. But these conditions are generally associated with some other
complications.
Yes, some other systemic conditions as well.
Okay. Doctor, before we get into the more important question, I have a sub question to this topic. People who have, let's say, glasses from very early age, are they more prone to get into glaucoma issue, or how is it?
See, there are certain risk factors, if I can just enumerate. One is ocular trauma, any kind of trauma to the eye. Second is any complicated intraocular surgery, any complicated eye surgery for that matter. Third is age more than 40 years. Fourth is any positive family history, for glaucoma. Then you have uncontrolled diabetes or uncontrolled hypertension. And lastly is high myopia. Myopia is minus number. Minus number is short-sightedness, that the patient can see for near, but then for distance they will need glasses. So high myopia is a very important risk factor for glaucoma. High myopia and patients more than 40 years of age, it is very, very common and they must undergo a screening. Yes.
Thank you. Now coming to the main topic once again. What is the difference between cataract and glaucoma?
Yes, this is very commonly asked to me because in Hindi or in Marathi, the words sound very similar. Cataract is called as motiyabind and glaucoma is called as kachbind. And in Hindi, it is motiabindu and kala motia or kachbindu. So it is very similar sounding, and that is why I have to explain it to everybody. Now, cataract is the normal aging of the human crystalline lens. This is normally, I'm sorry, I'm showing you the wrong one. It is normally transparent. Okay, and this is important for all the focusing which is happening over here. It is like the lens of the camera that we use. All right. Now, due to aging, this may develop opacification or say whitening or age-related damage, and it may appear like this. There are different kinds of cataract. This is called as cataract. And because it is present right in the center, the patient can identify that Baba, something is wrong with my vision and I need to go and check with the doctor. The problem with, and this is the part which is affected in glaucoma. So the front one, when there is
cataract
damage, this is cataract and this is glaucoma.
Now getting affected is glaucoma.
Yeah. If I can just add, normally we get a very good vision post cataract surgery. Why? Because your entire cataract is removed and a very nice clear new lens is placed over here, and therefore the patient is very happy. The patient regains 100% vision.
And I think sometimes those who have glasses, even that gets removed. They can see without.
Yeah, because these days we have very nice premium lenses and we can customize it for every patient. And in glaucoma, the problem is we will not be able to exchange your optic nerve. I cannot remove this optic nerve and place a new optic nerve over here. That is not possible.
Absolutely.
If I can also add, this is something that people ask me about eye donation. If there is a donated eye, can you use it over here? This is important because for eye donation, we change only the anterior or the frontmost part. These are eye transplant surgeries. We change only the front part. Rest of the eye is not transplanted. Though we might remove, if you have seen any cadaver enucleations.
Yes.
We might remove the entire eye, but while surgically using it, we use only the anterior part or some part of the sclera. We don't use the entire inside part of the eye, and therefore eye transplant surgeries will not work for glaucoma at all.
How can a person know that he or she has a glaucoma?
Right. Now, again, as we had a talk about cataract, because the center vision is affected, the patient can identify something is wrong, and therefore he will definitely come and show to a doctor. The problem with optic nerve head damage is the visual field is affected.
Okay.
Field in the sense, if I am looking at you, I can see there is, say for example, there is a window over here, there is a window over there. I can even recognize the roof and the floor. This is called as my visual field. For example, if I'm driving, I know what vehicle is standing beside me. I don't have to look and check at all the vehicles. Now, this is called as visual field. In glaucoma, your visual field gradually tends to reduce. Now, initially, if say, for example, 10, 15, 20% of visual loss has occurred, the patient will not identify it, because in case if I have to see over here, I can move my neck, I can move my hands, and I can have a look. So, mild to moderate diseases are generally lost because of this. Patients, when they come to us, they generally come with advanced disease. This is tunnel vision. Something like a telescope. If I ask you to put up a telescope in front of an eye, and if I ask you to work, this is the kind of problem that these patients face. Second is, glaucoma will never lead to any redness or pain or watering or whatsoever. 90% of the patients will have absolutely no problem. There are few patients of mine who tell me very frankly कि मैडम आप बोल रहे हो glaucoma है, टेस्ट पॉजिटिव है, इसलिए हम दवाई यूज कर रहे हैं, अदरवाइज हमें कोई तकलीफ नहीं है. It is so very common. Now there is one subset which is called as primary, which is not primary but angle closure glaucoma. In angle closure glaucoma, some patients may complain of some redness or headache or eye, but then that is a very small subset of patients, not everybody.
Okay. So what I understand from your explanation in a very simple language, if I want to say, if the front vision is affected, I have a cataract problem. And if the peripheral or those things I'm not able to, I can feel there is something, but I'm not able to see, my vision is shortened, then it is a glaucoma case.
Yes.
How, clinically, how do you diagnose it? And what are the tests that person has to undergo?
Okay. We have to take the patient for a routine routine ocular evaluation. Can you see this is the entire there just behind me? The problem with people visiting only for glasses number is they don't undergo this investigation. They only check for the glasses. भाई दिख रहा है कि नहीं दिख रहा, number है कि नहीं है. That doesn't is not true for glaucoma. You have to undergo a proper slit lamp examination. Then we put in a special drop that is called as a pupillary dilation drop, because of which your pupils will expand and I will be able to see the entire part of the eye. This is one thing that I ask everybody, because without that drop, I can see only the anterior part. I cannot see anything else properly. But when I dilate you, I will be able to see everything. I will be able to see the optic nerve as well. So this is the clinical evaluation. There is something called as angle closure, which can be identified by gonioscopy. Gonioscope is a special lens which we use to put on the eye, and we can identify, recognize different kind of diseases, and because that will help us in management. This is only the ocular examination. Now comes the structural and the functional. Structural, as to how much structure has been lost over here. This can be done by doing an OCT, that is called as optical coherence tomography scan. Now this scan can tell us what structure has been lost. Second, we do serial photography of the disc also. This also helps us in certain cases. Second one is perimetry or visual fields that you might have heard of. Now perimetry will tell me about the functional loss. What amount of vision that I have lost. I can actually tell the patient, see, this is the part that you cannot see. And that is when that they realize. The third important part is when we check for the intraocular pressure, it is dependent on the thickness of the cornea. And for this, we have a special machine called as the pachymeter. So these 3 and 4 investigations are very essential, and they should be repeated every 1 or 2 years as and when required,
Yeah.
according to the severity of the disease
This
in that
so,
particular patient.
so when we go for our regular checkup, because there is some awareness, and especially people who are working on the screen constantly, they do have it as a part of their regular checkup package, or something like that, wherein they do visit the ophthalmology and they undergo the test. Do you advise it that after 40, or let's say 45, the person should go for such a detailed clinical diagnosis?
Detailed ocular examination at least every 2 years should be done by everybody who is more than 40 years of age. Because not even glaucoma, there are so many intraocular
Other, yeah.
diseases which can occur due to age related changes.
Yes.
And only finding out the classes number is not ocular examination.
Sufficient, huh?
That is one. Second thing is, there are so many people who are suffering from other unrelated
Yes.
diseases like diabetes and hypertension,
Hypertension,
kidney
BP,
diseases,
yes.
heart diseases.
Yes.
Now, all these diseases can lead to changes in the. I mean, I am slightly digressing, but this is one thing I want to tell everybody. Now, these diseases are diseases of the blood vessels. These are microangiopathies. You cannot see any blood vessels anteriorly. What we see are the blood vessels over here inside the eye.
Yes.
Now, when I examine the retina, I can tell you whether your diabetes is controlled or not, because the amount of damage that I can see, it directly extrapolates to the damage which is present in your body. Because the eye is the only organ when I can actually see your blood vessels. The doctor, your physician cannot go and see at your kidneys blood vessel or your heart blood vessels. Even when we do an angiography or other blood tests, they get a gross idea. But this is where I actually see that.
The nose, yes.
This acts as a biomarker. That is why physicians always will expect you or tell you to go and get your fundus evaluation. This is called as fundus evaluation.
Fundus evaluation. I see.
This is very, very important.
Now, what are the treatment options if somebody unfortunately has got it, and there are chances of more people getting it due to the lifestyle, the stress, the travel time, and many other factors add to it? And also, first of all, can the glaucoma be cured? Because you said that treating cataract is different and treating glaucoma is different. So, is it curable? One, and if so, then what are the treatment options?
Okay, coming to the last question first, it is not curable. As I explained, I have no exchange option for this optic nerve. I cannot remove this optic nerve and put somebody else's optic nerve. There are clinical trials going on for stem cell therapy, but they are still clinical trials. Nothing is approved yet, and nothing is in the market as of yet. So this is the first thing. Second, it is a preventable disease. And if I give you statistics, there was a study which was published by the All India Institute of Medical Sciences, New Delhi, that every 8th person, more than 40 years of age, every 8th person either has glaucoma or has a risk factor for glaucoma.
Okay.
It is so common and it is so prevalent. But unfortunately, because that disease produces no symptoms, there are so many patients who will never know. They are so
ignored.
Yeah, there's so many people who might be suffering, do not know for that. That is the first thing. Second, as I told you that it is preventable. Now, coming to the actual treatment, we want to reduce the intraocular pressure, because this is only modifiable risk factor that we have. I cannot do anything to your age. I cannot do anything to your family history. I have no treatment for your myopia. I have no treatment for trauma that has already been occurred, or any complicated eye surgery that has already been occurred. The intraocular pressure can be reduced either by putting eye drops.
Okay.
These are simple eye drops. They have to be used either once or twice or thrice or whatever is the scheduled dosage. Eye drops is one. Second is lasers can be done. Now there is something called as YAG iridotomy. Now this is very specific for angle closure glaucoma. That is the first line of therapy, and if your doctor has advised it, please undergo that. So one is that. Second procedure could be an argon laser trabeculoplasty or a selective laser trabeculoplasty, in which the filter of the eye, through which the extra water goes away, extra fluid goes away. Now this filter is treated. With age, this becomes blocked because of the iris pigments. This is aging related. And therefore, with the laser, we try to open up all these clogged channels. It is something like similar to working in a kitchen. Your kitchen drain becomes blocked. What you do is you'll put in something, either some chemical like Drain-X, or you can actually go and mechanically open it up. So that is the second thing. There is cyclophotocoagulation also. That is the tap which is working over here and producing that fluid. So I can actually go and close that tap as well and titrate it. That is cyclophotocoagulation. Next, what you have is trabeculectomy. Trabeculectomy mein, okay, the fluid is being formed, but then this outflow channel is being clogged. So what we do is we create a new channel over here, superior.
Okay.
Now, this new channel, we try to stabilize all the pressure. But then, yes, every surgery has its own chances of complications and associations and everything. There is something new these days, which is called as minimally invasive glaucoma. In the traditional glaucoma surgery, we have to take a larger incision, and it does need suturing also. We need to put sutures. In minimally invasive glaucoma surgery, we use the same incision that we use for cataract. Cataract these days can be done in 2.2, 2.6 millimeter incision. It is even smaller than the tip of the pen that I'm holding. Now, using the same incision, we can go and do the glaucoma surgery. But then there are particular indications for that. And in very recalcitrant cases or secondary cases or very small subset of cases, we can have an external valve also. These are called as glaucoma drainage devices. So we either can use eye drops, we can use lasers, or we can use glaucoma surgeries proper. That will depend upon the type of glaucoma and the severity of glaucoma that you have.
Okay, now as you say that there is no treatment as such, or you cannot cure it because it's very simple. You cannot replace the nerve. So there is no question of doing any so-called replacement or what they call it, implant.
There is no treatment. There's no treatment.
Forget about it. There's no treatment. Okay. So what are the risk factors if somebody has already got it, glaucoma, and now with whatever treatment is possible, will they lose the real peripheral vision completely, or there are still some hopes?
See, it depends on the stage at which your disease has been identified, and that is first part. Second is compliance. As I said, कि patients generally say कि हमें कोई तकलीफ नहीं है, हम दवाई क्यों use करें? That is the second important thing, because I have to reinforce it every time कि नहीं बाबा, you do have that disease and you have to use it, and you have to use it lifetime. Second, third important thing is, it is unlike taking a tablet. If somebody has diabetes and the patient has been given metformin, the patient will remember it कि खाने के साथ में metformin लेना है. Patients will very easily, what I must say, forget about taking eye drops, because for them eye drop is not something very handy. It is not very handy. Yes. But yes, designs have improved. Yes. Everything has improved. The second point, as I said, is compliance. Compliance is important. You don't use medicines, I will really not be able to help you. 50% part is mine, 50% part lies here with the patient.
That's true with every disease, I would say.
Yes. Third is light exercise is important. I think it will go hand in hand with other diseases that we are now seeing on the rise. These are all lifestyle diseases. I must say, diabetes and hypertension, though they are genetic as well. But yes, your lifestyle is,
by and large, it is lifestyle related.
Yes, a very, very large part of lifestyle as well. Same with glaucoma. The glaucoma will also be improved. I will not say improve in your vision functionally, but yes, it does help you in the long-term progression. Why? Because this is an age-related disease. So that is why even if I try to maintain your vision, say मैंने बोला 20% vision है तो 20% ही रहेगा, that will never happen, because your eyeball is also undergoing age-related
damage. Yes.
The earlier that I can diagnose, the better that I can control, the tighter that I can control, the better the compliance, better lifestyle diseases, and better lifestyle, and say low amount negligible amount of lifestyle diseases or systemic diseases, or even if you have diseases, you keep them under control. So that's it. That is how, on the whole, it will lead to a better glaucoma treatment in my case. And lastly, there are no other supplements that are required. This is one thing that patients ask me. कि मैडम ग्लोकोमा है, आप कुछ मल्टीविटामिन दीजिए, कुछ सप्लीमेंट दीजिए, तो देयर इज नथिंग ऑफ लेट या इवन टिल डे दैट विल वर्क फॉर ग्लोकोमा. देयर आर नो सप्लीमेंट्स रिक्वायर्ड. You just eat a nice and healthy balanced diet. That is all.
So that was my question. Do lifestyle changes help in managing glaucoma?
Yes, I mean, we just discussed lifestyle changes. Yes, one is you control your diseases that you have. Second is light exercises. Third is compliance, very important. And fourth is screen time. Screen time, though it will not have a direct effect, but it does change. It does lead to increased aging. But then that is still is under suspension, and still studies are being done on that.
Some people also say that putting the eye drops is absolutely not advisable because your eye is naturally lubricant and it will produce its own fluid. Which theory is correct?
Well, actually, if you're talking about dry eye, glaucoma, anti-glaucoma medicines, majority, if not all, will lead to some amount of dryness. Ocular surface disease is a very well-known complication associated with many of them. But we do have which are preservative-free, which are ocular surface friendly. So the amount of complications that we will see will be lesser. I will not say zero, but then it will be lesser. The patient will be. The second thing is, madam, putting eye drops is slightly difficult. As I said, taking a pill is easier. Putting eye drops is difficult. Important is that I have to tell the patient time and again that this is the only thing that will help you in the long run. There are patients who will not be able to who are not compliant, yeah, who will not be able to use medicines due to some arthritis or something, or they have severe allergic reactions to these eye drops. In certain cases, we do take them for laser therapy. That is the second step. We do take them for laser. There are certain patients who we take them for surgery also. There was one patient who was allergic to all the three medicines. So I said, Papa, if nothing is working, I have to take it for a surgery. So post surgery, doing well. Yeah, there's only one thing. If I just can give you a take-home message for all viewers, I would like them to say to know that if you're more than 40 years of age, if you have never undergone a ocular examination, please do it today. Please insist for a whole retina checkup when you are asked to put in that drop. Wait for some 20-30 minutes, half an hour. That is important. Second is if you have diabetes, if you have hypertension, controlled, uncontrolled, still go and get this fundus evaluation done. If you have any disease which has been identified and your drops have been given, please use those drops. Whenever you use those drops, don't touch the upper lid, because once you touch the upper lid, the eye will try to close, body will try to close it. You just have to pull the lower lid. There is a small lake which is formed. Instill only one drop. Don't use more than one drop, because everything will be wasted over here. The eyeball is such that it will hold only one drop of the commercial available drop size which is available. That, and yes, balanced diet goes a long way.
Great. Yes. I think people should definitely focus on their lifestyle, their eating habits, and other parameters which are damaging their nerves. And as you rightly pointed, very important point, that other organs, the experts cannot see your nerves, but the eye specialists can see your nerves and make out the level of damage you have already gone through. Excellent. Thank you very much.
Yes, eyes are windows to the
eyes are windows to the soul. I said
eyes. I can look
the body
through your entire body. Yes.
Great. So through eyes, you don't only see the external world, you can see the internal world as well.
Yes, that is very well put.
Yes. Thank you, doctor. Thank you for your time.
Sure. Thank you. Bye.
Bye.